And our regular update on Ebola, the World Health Organization says that as of today, Mali has officially reported a total of 6 cases of the disease with 5 deaths. WHO is working closely with the government of Mali to keep the Ebola outbreak from spreading. After intense tracing and monitoring of contacts of the first case, which as you will recall was a young girl, all 118 contacts have now passed through the 21-day incubation period without developing symptoms. The virus almost certainly was reintroduced to Mali by a 70-year-old Grand Imam who fell ill in Guinea and died in Mali on the 27th of October. WHO is currently assisting the government of Mali to identify all potential chains of transmission, monitor contacts, and prevent the outbreak from growing larger. To date, 554 contacts have been identified, and nearly all have been placed under surveillance. The Ministry of Health, supported by the WHO, has augmented the number of staff engaged in contact tracing by drawing on polio surveillance teams and using local medical students with training in epidemiology. The country is also ramping up its capacity to perform exit screening at Bamako Airport. Meanwhile, UNICEF also intensified its emergency response to Ebola in Mali, increasing food and water delivery and providing support on hygiene and sanitation. UNICEF is bringing additional support to local clinics, particularly in the area close to the border with Guinea. And the head of the UN emergency mission to respond to Ebola, Anthony Banbury, is today in Bamako to consult with national authorities and partners on the ground. Also on Ebola, the World Health Organization stressed today that efforts to contain the outbreak are currently hampered by slow and complex diagnostic tests that impose a number of additional logistical challenges. Therefore, WHO has launched 2 urgent initiatives to stimulate diagnostic innovation and to expedite the delivery of better and faster tests to West Africa. One aims to minimize the barriers faced by the diagnostic companies to develop and deploy their tests, and the second comes with the establishment of an emergency quality assessment mechanism. And we have more from WHO on their efforts. The Secretary General on Thursday and Friday will chair the twice-yearly meeting of the Chief Executive Boards of the UN, bringing together all the heads of UN system to discuss issues of mutual interest. The Deputy Secretary General and the UN heads of agencies and funds and programs will also attend. The World Bank Group will host this session of the CEB at its headquarters in Washington, D.C., and discussions will focus on post-2015 development agenda, among other topics. One of the CEB sessions on Friday will be on Ebola response, and following that session, about 12:45, the Secretary General and CEB members will have a brief press encounter at the World Bank on Ebola, and we'll see to give you the details if you can at least watch that on the World Bank webcast.